Hey friends, let's talk about a disease that most people, including healthcare practitioners, don't know about. It's called occlusal disease. So what the heck is that? Occlusal disease is a disease of your bite, of the way your teeth come together. How can your bite be diseased? And how come no one knows about it, or how come no one talks about it? Stay tuned until the end of this video to get the answer to your questions and more. For those of you who don't know me, I'm Dr. Priya Mistry. I'm a general dentist with a practice in Vancouver, Washington. That is in the USA, it's not Vancouver, BC. At my practice, we focus solely on taking care of those with TMJ disorder. So this includes clicking or popping noises in the jaw joints, crackling noises in the jaw joints, headaches, neck pain, ear pain, dizziness, jaw pain, gum pain, tooth pain, numbness or tingling in the face, facial pain, difficulty swallowing. Lots of different things go along with this. So at my practice, we are taking care of those who suffer from this disorder. If you or a loved one suffer from TMJ disorder, please be sure to subscribe to this channel, as there's tons of information. And also, once you subscribe, it pushes these videos out into the interwebs so that more people can find them and more people can get help. Now let's get right into it. What is a disease of the bite? What is occlusal disease? Well, my friends, the way our teeth come together can have an enormous impact on our spines and our central nervous systems. Interesting, right? When I first heard this, I was blown away. I was a little skeptical too, but after treating patients with TMJ problems for the last 7 years, the proof is in the pudding. And I see the connection between our bites and our nervous systems and spines daily. Let's talk about the spine first. In 2003, there was a study published in the Journal of Craniomandibular Practice. This study was done on rats, and the images are displayed here. Image A shows the rat before anything was added to its teeth. You can see a pretty straight spine here. Image B was taken 1 week after the rat's bite was changed by adding tooth-colored filling material to purposely make the bite imbalanced. Look at the curvature in that spine. Image C was taken 1 week after tooth-colored filling material was added to the opposite side to balance the bite once again. Take a look at how the spine straightened out again. I've linked this study below if you want to take a closer look at it. The point of bringing up this study is to highlight the fact that our bite, the way our teeth come together, can have a tremendous descending impact on our bodies. Crazy, right? So the way the teeth come together can impact our shoulders, our spines, our hips, and our feet. The bite can impact the whole body. I definitely wasn't taught this in dental school, but I've learned it well as I've treated thousands of TMJ patients. Keep in mind that everything is connected. The main body parts that work together to maintain our posture are the feet, the hips, the entire spine, the shoulders, and the jaw. The jaw joints are the only joints in the body that have a hard end stop. This is where the teeth come together. So the bite directly influences the jaw and the jaw joints. The jaw and the jaw joints influence the shoulders, the hips, the spine, and the feet, and vice versa. A hip being rotated or tilted can feed up the spine and affect the shoulders or the jaw. Other practitioners that do have an awareness of this include PRI, Postural Restoration Institute physical therapists, or most physical therapists in general. Upper cervical chiropractors definitely have an awareness of this. So there are other practitioners that are very aware of how the jaw and the bite can impact the rest of the body. Let's move on to how the teeth come together. The bite affects the central nervous system, or the CNS. Our back teeth, our molars and premolars, the teeth back here, have peripheral nerves that synapse directly inside the central nervous system. All other peripheral nerves have a stop-off point before they get to the central nervous system. Interesting, right? The fact that the back teeth do not have that stop-off point simply means that the way those teeth specifically come together when you bite or when you move your jaw side to side, as we do when chewing, can have an enormous impact on the central nervous system. The bite itself can irritate muscles and nerves, leading to headaches, jaw pain, tooth pain, gum pain, neck pain, ear pain, stuffy ears, dizziness, clicking or popping noises in the joints, and more. So the whole point of this video is to highlight the fact that our bite being imbalanced can have serious negative impacts on our bodies, ranging from our posture being off to impacting our central nervous systems. This can result in a lot of discomfort and or pain. In many videos in the past, I've said that the muscles and joints should always be stabilized before balancing the bite. And I am making this video to eat my words. There are instances where balancing the bite will actually be the best first step. The way I balance the bite and decrease pain is by using T-Scan 10 technology and Disclusion time reduction, DTR therapy. For more information on that, check out my video, What is T-Scan 10 and Disclusion time reduction therapy, which I've linked above and below. When doing Disclusion time reduction therapy or DTR therapy, I use a very, very thin sensor. This sensor is 100 microns thin. For reference, there's 1,000 microns in a millimeter. This sensor is also incredibly accurate. The way we learn how to check the bite in dental school is to use good old articulating paper. We place the paper in between your teeth and have you bite down. Tap, tap, tap. Probably sounds familiar, right? We are taught that the size of the mark is directly proportional to the force. And that, my friends, is actually not true. Studies show that the mark size and force only correlate 14% of the time. Our method of checking your bite, what we learned in dental school, is only 14% accurate. Let that sink in. How accurate is this sensor? 95%, my friends. Which accuracy do you prefer when we're checking your teeth? 14% or 95%? I think the answer is clear. So let's get back on track. This video is all about occlusal disease, a disease of your bite, and I hope you now understand how your bite can truly affect your whole body. Thanks, my friends, and again, I'm Dr. Priya Mistry. If you found this video helpful, please feel free to like, subscribe, and share with your family and friends. To ease TMJ discomfort or pain from the comfort of your own home, please be sure to download my free PDF guide, which is on my website. If you scroll all the way down and enter your email address, you can download that PDF guide. And remember, my friends, you can never have TMI about TMJ. Thank you.